Hello, everyone. It's Phil Jacobus. Thank you for joining me. It's Monday, August 24th. I'm here at my office in New York City, and today I will be sharing an interview with Jeff Fallon, who I interviewed from my home in Woodstock, New York last week. And this is a really interesting interview. It's one of the few times that I shared the content with my wife in our evening stroll. But before I share with you the interview with Jeff Fallon, let's take a look at some of the news stories that appear in Healthcare Business News Online. Here you see a story that appeared in our August issue of Healthcare Business News magazine, the print magazine, about if you're preparing for a major medical equipment moving job. I've been involved in this sort of thing before. There's a lot to it. This article is interesting. There are probably things that some of you already know, and there may be some things that we remind you about. It's really very interesting, and I encourage you to read it. Another interesting story here is how half of breast cancer survivors experienced delayed care in the first weeks of the pandemic. Sadly, this occurred. Also, a story worth reading. As always, I encourage you to sign up for our online news. It's free, especially if you don't receive the magazine. You'll eventually get all of the stories that appear in the magazine. Hello, everyone. And as promised, today I'm joined by Mr. Jeff Fallon, who is the chairman and CEO of eVideon. Jeff, thanks so much for joining us.
Hi, Phil. Thanks so much for having me. I'm really looking forward to our conversation.
You know, I have to admit that your company is one of the more interesting, offers a service and that is more interesting than many I've heard of. But for those of watching today who are not familiar with your company, could you, from 5,000 feet in the air, describe what your company does?
Yeah, sure. The short story on this is, Phil, we're a software company that there's a little bit of hardware involved as well, but we use smart devices in the patient room. That's the hospital room, whether it's a smart TV on the wall or a tablet at the bedside or the patient's own device, or we use a digital display for the whiteboard or a digital door sign, just to modernize the information flow between the clinicians at the hospital and the patients in the bed. We integrate with the information systems that the hospital's already invested in, like the electronic medical record generally, and real-time location systems or dietary meal ordering systems and the like, just to modernize what it is to be a patient informed better in the hospital bed, and what it is to be a nurse who's tasked with engaging those patients and improving their understanding of their care and educating them and preparing them for life after the hospital. So it's really about putting patients at the center of their care, and rather than having them be passengers on it, really putting them sort of the steering wheel of their care and informing them. That's the core mission that we're on, and it's one whose time has been coming for quite some time. The pandemic seems to have certainly accelerated the urgency for patients to be strong participants in their care rather than just recipients of it. And technology that provides the ability to do this at a pandemic safe distance is also certainly top of mind for providers these days.
I know that this you're offering, not only does it make it easier on the clinicians, and lowers the burnout for clinicians, but it also reduces stress on the patient. Can you give us some examples of how you accomplish that?
Yeah, well, there's a million use cases we could talk about that are helpful to patients to just reduce their stress, improve their understanding, which is quite stress reducing in and of itself when you're feeling very vulnerable in a patient in a hospital bed. You know, we've all come to rely on these devices, these supercomputers we carry around in our pockets, but when you're a patient in a bed, even in 2020, generally you find yourself woefully uninformed about what's happening for you medically, what's happening next, and who is this team that's taking care of you. So because we use these smart devices in the patient room connected to the information systems, we're able to prompt people to complete video education when a new medication has been prescribed, for example. So while you're watching movies on demand or browsing the internet or high definition TV or relaxation content, a little dialog box will pop up on the tablet or the TV saying, Phil, you've been prescribed hydrochlorothiazide. Click this button and watch a short video that educates you about the medication you're going to be taking. Idea being, use asynchronous video communication that's built with adult learning principles or pediatric learning principles, as it were, if that's a pediatric hospital, to just help people better understand what got them in the bed and reduce the chances that they'll be readmitted for complications because you've done a better job educating. Now, along the way to doing that, that provides a massive amount of efficiency and therefore satisfaction for the clinical team who's on the hook for educating and preparing those patients for life after the hospital. The way they've normally done it is to bring a pile of sheets of paper into the room at discharge. We're doing this more through automation, through video, throughout the stay, rather than something that happens in the last hour at the hospital. Does that help?
Well, that helps a lot. How does it, and it's a really interesting idea, and as you say, overdue. What about clinicians? How does it help clinicians, and how does it help the patient communicate with the hospital?
Yeah. So if you're a nurse in a hospital today without an interactive system, you're on the hook for educating these patients. And as I said a moment ago, you're likely coming in with a pile of pamphlets and a few printouts, and you're doing it manually face-to-face, which isn't incredibly efficient. And these days, i.e. in a pandemic, it's also quite risky and uses a lot of PPE to come into the room and kind of do that. So we put the patient in the driver's seat of the communication, give them the ability to request things that they might need, which normally would have required them to hit a nurse call button, a 1979 technology, which is still the core communication tool in hospitals today. And in an era of Apple and Android smartphones, it's just ancient technology. But this patient's able to report some issue, like they need a blanket, or the room is too cold, or they might be in pain. And that information should go to very different resources, experts within the hospital to take care of that. So a patient in pain should rightly alert the nurse. That message from that patient will go to the nurse. A patient who needs a blanket maybe goes to an entirely different department. A patient who is hungry is going to route that message to the dietary staff. So we empower this patient to get that information to the right person at the right time, and then we can reach back to that resource. Whoever was on the hook for bringing the blanket or the meal or taking care of the pain medication, we can reach back to that patient, say a half an hour later, and say, Phil, your comfort's very important to us. How's your pain level now? Or did you get the blanket that you requested? And if Phil says everything's good, tremendous, it's simply logged. If Phil says I didn't get my blanket or my pain is not taken care of, we can escalate that to somebody else and ensure that it's been addressed. Idea being, use this kind of technology to wire into your organization and always response to patient needs, because in a patient satisfaction or HCAP survey, the only answer that matters, the only answer that literally is calculated, is always on that survey. So this is about helping your organization more continuously, always respond to patient needs. Now, for the staff, there is alert fatigue is real, right? So you need to be careful about how you're alerting them. But for the staff who's heretofore on the hook for answering their call button for every one of those service needs, whether blanket, meal, or pain, it offers incredible efficiency for them to now only receive the ones that are really clinical issues. It lets them operate at the highest level of the clinical authority rather than pivoting housekeeping needs
Yes,
for the
it's
patient.
a lot more efficient, and I can see how it would free up time for clinicians and lower their stress, therefore, and allow them to concentrate on things that are more urgent. How long does it take to roll out a program like this? Is that a fair question?
Yeah, it's a very fair question. It's a common one that we get as well. And I would say that we move incredibly fast. Like parts of our solution, like this virtual visitation tool that we've just launched called Hello, we could light that up in 24 hours. A fully integrated bedside multi-display solution, like I've kind of described in a big broad way here, and with the kind of integrations that need to be done, it could be 3 to kind of 4 months. But the limiting factor generally in our ability to light this up in a timely fashion is not on our software or integration capabilities or our timeline. It's really around accessing the patient rooms. And if a room is empty, we can go in and do this stuff really, really quickly. If a room is occupied, we need for it to get empty, and we need to get in and out of that room pretty quickly. So the limiting factor is generally room availability, sometimes hardware availability. A really large project with a couple thousand smart TVs, especially these days during this pandemic, the supply chain being kind of choked off in some areas as it has been, getting your hands on 2,000 smart TVs can be a limiting factor as well. But I think the general short answer, Phil, is kind of 3 months, 4 months to light this up.
Right. So, and yet the time savings, the time and energy savings is forever. And it takes us into the current century,
It's remarkable if you think about it. At a time when somebody is just incredibly vulnerable, laying in a hospital bed, maybe in fear of their life, needing more information than ever before, and feeling scared, they have access to so little information. Dr. Google's a thing, and they will use their smartphone to search Dr. Google. Our belief and our customer belief is that the hospital has a tremendous opportunity to kind of step between the patient's smartphone and Dr. Google and provide the information that they want them to have, the actual authoritative source about here's what's happening for you, here's the care team, here's what's next, here's how you live after this hospital experience. And but it's a tall order to ask the clinical staff to go do that face to face. And so technology can really be the tool that accelerates their capability in doing that.
May I ask, do you have canned material on lots of topics like iboristatin or whatever, or does the hospital have to build that data from their own database?
Yes, that's a tremendous question. And we're actually not a content company. We work with our hospital clients occasionally to create custom videos that they find something missing in the market. But we work with a number of incredible video education companies that that's their full-time job is creating cutting edge, impactful, meaningful, engaging content. And then we like to think that we provide a tremendous service to our clients by curating the best of the best from these different sources. So some organizations, some of these companies create pediatric content, but it may not be as great as the pediatric content that some others have created. So we help them to kind of knit together an entire library that meets the need of their particular hospital and the patient population that they treat. So short answer is, we work with third parties that create this content. We don't create it ourselves. We're really the player for it.
And my final question, since we're running over our 5-minute limit here for Healthcare Business News, 5 minutes in healthcare. Which departments do you interface with to
uh, get started or to make it happen?
Yeah, in our experience, nursing leadership needs to want this. The nursing organization is the primary beneficiary of the benefits of an interactive bedside system. Um, the technology organization needs to be comfortable with the bits, bytes, and the hardware integrations of it. So those are the two stakeholders that are really the driving decision makers for a decision to use this kind of technology. Nursing first and technology second.
It seems like whoever cares about, pardon me, whoever cares about patient satisfaction, especially in a competitive market,
Yeah,
would definitely be interested in this product, this service.
for sure.
Well, Jeff Fallon, you are a very interesting guy. Did you think of this? Is this your idea, or?
It's funny. It's funny you asked that. In a way, I feel like a team that I was leading back at Johnson & Johnson, working with Cleveland Clinic when the first chief experience officer was hired by a legendary CEO, Dr. Toby Cosgrove. We were ideating around this space and thought somebody needs to create this. And I wound up, in a kind of circuitous way in this space through a venture capital group that invested in a company in this space, and it's been my passion and my career since that time. I didn't invent it. I think a lot of people think they've kind of thought it up. I think a bunch of us thought it up all at the same time. It's kind of an obvious idea, and I'm thrilled to be part of it, and hopeful that we can really make a difference, because it's an idea whose time has come, and hospitals and nurses really deserve, not to mention patients, really deserve this.
I hope that we can hear from you again post-pandemic, and I really appreciate you spending time with us. You're a very interesting and charming, I might add, guy.
Thanks, Phil. Tremendous to be with you.